So this is case 1. I chose a walker because it provides the most stability and support for a patient who is 1 day post-op. We are going to use a modified 3-point step 2 gait due to his weight bearing as tolerated precautions, and this provides the most stability and safety. The walker is going to be fit to the ulnar-styling process of the wrist crease and allow for 20 to 30 degrees of flexion. Hi, my name's Riley. I'm your physical therapist. I'm gonna wash my hands. Can you verify your name and date of birth for me?
Yeah, it's Thomas Johnson and June 2nd, 2003.
How are you feeling today?
A little sore where I had surgery yesterday, but I'm feeling okay.
Are you ready to get out of bed and start walking?
If you think I'm ready, yeah.
Okay. I'm gonna put this gait belt around you for your safety and mine. Okay. I'm gonna show you how we're gonna use our walker today. We're gonna move the walker first, then your effective leg. Weight bear as tolerated, so you can put as much weight on it as you want until it's too painful. So effective leg, then your right leg. Okay? I'm gonna have you scoot towards the edge of the bed for me. Good. I'm gonna have you keep your left leg straight. Put this foot underneath you so you can stand up. We'll get on this side of you. And then whenever you're ready, push off the bed, not on the walker, okay? Good. Now you can put your hands on the walker. Are you dizzy at all?
No, I'm good.
Okay. Whenever you're ready. So the handrails fit at the ulnar-styling process. I'm gonna have you bring that for me. And about 20 to 30 degrees of flexion. Turn towards that way. And have you pivot. Good. I'm gonna have you stand in the walker more for me. Keep your arms straight in there. There we go. Good job. I'm gonna have you turn towards your right for me. Oh, I got you. Are you okay?
Yeah.
We're gonna get you back to bed, okay? I'm gonna have you pivot and turn backwards, and we're gonna back up to the edge of the bed. Back up until you feel the edge of the bed on your back of your legs. Okay, now you're gonna reach back with one arm, straighten that leg out, and slowly reach it up. Good. I'm gonna take the skate belt off from you. How do you feel now?
Pretty good. I was kind of scared, not gonna lie.
Yeah, it's okay, I got you. Thank you for working with me today.
Thank you. All right, so this is case 2, and for case 2, we chose a walker because it provides the most stability for the first ambulation after surgery, and it just makes it easier to maintain prescribed that partial weight-bearing restriction. The walker is going to be fit approximately with the handrails right here, with the wrist crease, with that ulnar-styling process. And we want to make sure that our elbows are at a 20 to 30 degree flexion. And then because the right leg is partial weight bearing, about 40%, I'm going to use a modified 3-point step 2 gait so the patient can offload that right lower extremity with upper extremity supporting through the walker. And then since we don't have a scale, I'm just going to be instructing the patient to place only a limited amount of weight through the right leg, and then just some contact and partial loading on that right leg while using the walker and the arms to offload most of that weight. Hi, my name is Thomas, and I'm going to be your student physical therapist today. Before we begin, can I just get your first and last name and your date of birth?
Riley Hall, 8504.
All right, perfect. I'm just going to wash my hands before we begin, and I'll tell you what we're going to do.
Okay.
All right. So what we are going to do today, I'm seeing we're 1 day post-op, and we are eager to get out of bed, aren't we?
Yeah.
So can you tell me a little about your pain in that right leg?
It's pretty painful, but I'm just ready to get out of this bed.
You're ready to get out? Well,
Yeah.
That's what we're going to do today. We're going to get you using this device right here. It's a walker. We're going to be using it to get you a couple feet away, just so we can start walking on it, okay? Now, when we do this, I want to kind of show you what we're going to do before we begin, okay? So, we are going to be first with the walker, then we are going to go step into the middle of this walker with that right leg, and you're going to step 2, making your feet equal to that right leg, okay? And then you're going to follow that pattern. Step, step, and we're going to continue like that, okay?
Okay.
All right. So before we begin, I'm going to put this gait belt on, and with this gait belt, it's going to keep you safe, and it's also going to help me keep you stable and make sure everything's okay, okay?
Okay.
All right. Put this around you. If you'll just lift up your arms for me. It's too tight, let me know. That feel all right?
Yes.
Beautiful. And for this, I've already made sure everything was correct, but we'll go over it again. I made sure everything was right with the ulnar styloid process being in line with the handrails, and also with that 20 to 30 degrees of flexion in the elbows for my patient. But I'm going to put this in front of you. Beautiful. And then what we're going to do, I'm going to ask you to scoot to the edge of the bed, kind of keep that straight if you can. Beautiful. And what we're going to do is we're going to push up with our upper extremity. And what we're going to do is, you already got it perfect, beautiful. Have that left foot a little behind your knee. And what I like to say is we'll lean our truck forward, nose over toes, and we'll push up, and I'll help you a little bit. But once we're up, make sure we're stable, make sure we're not dizzy. I'll have you put your hands on the rail, okay?
Okay.
All right, so we'll go on 3, okay?
Okay.
1, 2, and 3. Beautiful. How you feeling? Any dizziness?
No.
All right, beautiful. Is the leg feeling okay?
Yeah, it's still pretty painful though.
Pretty painful?
Yeah.
All right, so let's not overdo it. So if you have any pain, we'll stop and we'll just take a break, okay?
Okay.
All right, so what we're gonna do is kind of what I showed you earlier. And for that, I like to say, since we didn't have a scale, kind of think of it as 40. So I wanna put most of that on my left, and the upper extremity, putting it up. So we're just not putting much on that right leg, but as much as you can, about 40%.
Okay.
So try to think about 40%, and if you have pain, just dial it back a little bit, okay?
Okay.
All right, so let's try to do that for me. But make sure, right here, as you can tell, it was perfect lining. She has that at the crease of the wrist at the ulnar styloid process, and as she moves out, we have that 20 to 30 degrees of flexion. Alrighty, so let us begin. So first with the walker, then with the right leg, pushing all our weight as much as we can, so we get limited on that right. Beautiful. Okay, that's fine, that's fine. So what I said, remember earlier, let's step to that leg. You're stepping past the leg, step to it, okay? And we won't have that much pain on it, okay?
Okay.
All right, so what we're going to do is we're going to turn that way. So kind of think this is the head. Take the head and face it to that wall, okay? We're going to pivot as slow as you can. Try not to put too much weight on that right leg, okay?
Okay.
Beautiful. Beautiful. All right, perfect. So now we'll go straight, same pattern as before. Walker, then that right leg. Step 2, beautiful. Step 2, beautiful. Good job. Any pain?
Yeah.
A little bit?
Yeah.
You okay? Do we need to stop?
No, I'm fine.
You're fine?
I'm ready to start walking.
All right, perfect. All right, so we'll stop here and we'll work our way back to the bed, okay? So for this one, we're gonna go that direction to our left. So kind of like earlier, it's the head was pointed to that wall. Let's pivot and try to keep as much weight off of that right leg as possible, just partial, okay? No, you're good. No, you're good. I got you. Beautiful. All right, we'll stop right here and we'll do the same thing. Head to that wall, pivot, and try to keep the weight off that right leg, okay?
Okay.
Beautiful. All right, we'll stop right here. Now I'll tell my patients, we'll back up until you feel something on that back of the knee, and we'll stop there and we'll go from there, okay?
Okay.
So just back up. Try to keep as much, try to keep 40% or less than half of your body weight. All right, you can stop now. So what we're gonna do here is I'm gonna have you put your hands back here. Beautiful, and then I'm gonna help you sit down, so lower yourself with that good leg, okay?
Okay.
On 3. 1, 2, and 3. Beautiful. Everything feeling okay?
Yeah.
Do you have any questions for me today?
No.
All right, well, everything looked good. I'm proud of you. If you need anything, I'll be here. But thank you for letting me work with you today.
Thank you.